Today we're going to look at the dynamic auscultation of the murmurs. So before we begin, we would like to ask a question, that is, in terms of hand grip, how was the murmur? What are the findings in terms of the hand grip? So in this video we'll find the answers to these questions and we'll learn in detail. So to begin with, firstly we'll look at the bedside maneuvers and the process will be, we'll look at the bedside maneuvers and we will compare the effects. So to begin with, first the inspiration. So in terms of the inspiration, what are the findings? So in terms of inspiration, there is an increase of VR, that is venous return to the RA, right atrium. So how does this affect? So here there is an increase in the intensity. There is increase in the intensity, and this is of the right sided. So it is of the right. It is of the right sided sounds. Increase in intensity of the right sided sounds. And next we'll look at the hand grip. So what is special about the hand grip? So in the hand grip there is an increase in the after load. So what does this contribute? So because of the increase in the afterload, there can be increase in the intensity. So there's increase in the intensity of the MR, increase in intensity of the MR, the AR, as well as the VSD murmurs. And there is also a decrease. There's decrease in the decrease in the hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy and the AS murmurs. Now, when we see the MVP, it is nothing but it is delayed onset of click. There is delayed onset. This is of the click or the murmur. So just to recap what we did here, we saw that firstly the bedside maneuver and the effects. This is how we are going to discuss. So in terms of the inspiration, there's an increase in the VR, increase in the venous return to the right atrium. So because of this, there is an increase in the intensity of the right sided sounds. And in terms of hand grip, how is it different? In terms of hand grip, there's an increase in the afterload. And what does this cause? This causes the increase in intensity of the MR, AR, as well as the VSD murmurs. Next, there is also a significant decrease in the hypertrophic cardiomyopathy and as well as the AS murmurs. Next, when we look at the MVP, there is a delayed onset as well as the delayed onset of the click or the murmur. Then we'll look at the Valsalva. We are going to look at the Valsalva phase 2. So in terms of the Valsalva phase 2, so this is by standing up, and here what we see is there's a decrease in the preload. So what are the findings here? The findings is there's a decrease in the intensity. There's a decrease in intensity of most murmurs. So there's a decrease in intensity of most murmurs, and what does it include? It includes the AS as well. And there is an increase in the intensity. There's an increase in intensity of the hypertrophic. There's increase in intensity of the hypertrophic cardiomyopathy. Increase in intensity of the hypertrophic cardiomyopathy murmur. Next, in terms of the MVP, there is an early onset. There is an early onset of the click or the murmur. Now to recap, we saw the Valsalva phase 2. So this is by standing up. So here when the Valsalva is done, there is a decrease in the preload. So what effect does it have? So there is a decrease in the intensity of most of the murmurs as well as includes the AS. And there's an increase in the intensity of the hypertrophic cardiomyopathy murmur. Next, when we look at the MVP, there's an early onset of the click or the murmur. Next, we are moving on to the rapid squatting. So what happens in case of the rapid squatting? So here what happens is there's an increase in the VR. There's increase in the VR, there's increase in the preload, as well as there is increase in the afterload as well. So how is the effect? So when we look at the effect, there's a decrease in the intensity. There's decrease in the intensity of the hypertrophic. There's decrease in the intensity of the hypertrophic cardiomyopathy murmur. Then there is also an increase in the intensity of the AS, MR as well as the VSD murmurs. Then when we look at the MVP, there is a late onset. There's a late onset of the click or the murmur. Now just to recap, we saw the rapid squatting. In terms of rapid squatting, there's increase in the VR and the increase in the preload as well as increase in the afterload. So the effect is there's a decrease in the intensity of the hypertrophic cardiomyopathy murmurs. So there's an increase in the intensity of the AS, then the MR as well as the VSD murmurs. So as far the MVP is concerned, there's a late onset of the click or the murmurs. Now we'll be answering our question. So the only question we asked was comment on the hand grip. So in terms of hand grip, what we see is there's an increase in the afterload. And what is its effect? The effect is that there's an increase in the intensity. There's an increase in the intensity of the MR, the AR as well as the VSD murmurs. Next, when we look at the other aspect, that is there's a decrease in the hypertrophic. There's decrease in the hypertrophic cardiomyopathy. Decrease in the hypertrophic cardiomyopathy and the AS murmurs. Then when we look at the MVP, there's a delayed onset. MVP, there's a delayed onset, and this is of the click or the murmur. So to recap, we asked the question on the hand grip. So hand grip, basically the afterload, it increases. The effect it causes is the increase in the intensity of the MR, AR as well as the VSD murmurs. And there's a decrease in the hypertrophic cardiomyopathy as well as the AS murmurs. In terms of the MVP, there's a delayed onset of the click or the murmurs. So this was about the auscultation, dynamic auscultation of the murmurs. To grow daily, please do subscribe.